More on the COVID cases and the federal help coming in. Let's get right to it with the Lieutenant Governor and the state's COVID-19 liaison, Dr. Josh Green. Good morning, Doc. How are you doing this morning?
Good morning. Thank you.
Now, first off, over the weekend, we hit a record. Do you think that we hit our peak on Saturday with 5,977 cases?
It's very likely that peak or that large number was an amalgamation of cases that had come over several days just because the system gets overwhelmed now with so many people getting tested. I do actually think that we've been peaking or cresting with our case counts, and our hospital counts should follow about 8 days later. We had 355 people in the hospital yesterday, which is a significant number, but it's about 100 less than our absolute max that we had in September. It's been very steady for the last 5 days, ranging from 339 up to 355.
So you think we'll be maybe leveling off and trending downwards after this week?
I do, actually. And the hospital number is the most accurate number we can get now, as we all know, because it's difficult for them to count all the negative tests with so many people getting tested. So the hospital number is a very discrete number. We had 347 in the hospital 3 days ago, then 347, and then 355. And the ICU number stayed almost exactly the same, between 38 and 39 people. So I think that has really been very steady and flat. And then, of course, we'll be getting help, which we and many other states across the country, if not all states, need. So it seems to be flattened, but we should not take anything for granted.
And speaking of that, any word on the FEMA nurses and staff that were expected to arrive in town this weekend?
Yeah, my understanding is they're here. There's about 200 of them this week and another 200 plus next week. These nurses are very important because with the rules now, people have to go out, as you know, with quarantine if you've been exposed to Omicron. So healthcare workers have essentially a 5-day quarantine after being exposed or catching the virus. It's much less severe. It's 5.3 times less severe than the Delta variant as far as putting you into the hospital, but it puts people out of work, and we have to have lots of workers to care for our patients. It's very good timing, and so I'm so thankful to the Healthcare Association, Hilton Raythel, and DOH for making sure that happened.
Now, due to the Omicron surge, the DOH says it can't keep up with the processing test results in its data reporting system and will no longer report the daily negative test results. Any concerns there?
There are concerns because I really think that we need to know the positivity rate, but they'll do their best. They've been overwhelmed, including some of their department has been devastated because they lose workers too, which is just something that we all understand is a reality with this pandemic. But we will have to get as much data from them as we can. Hopefully they can give it several times a week. I'll keep adding all of the data together that I can. Again, I can give you very clear ideas about the number of people in the hospital. We obviously can track some of the more serious outcomes, fatalities, but I can tell you to a person how many people are in each of our hospitals and therefore how many healthcare personnel we have to add to help out. So that's the most important number for sure. They will give us the positive numbers overall, and that also helps as a trend, but it's important to recognize that we have the big picture and we do have the capacity to take care of patients. And thank goodness far fewer people are ending up in the ICU with Omicron.
Now, speaking of short-staffed, should more resources be put into testing centers? Because it seems like the Blaisdell and other testing sites are being overwhelmed right now.
Yes, but the resources sadly are finite. Having these additional 200 plus nurses will help because they can be used for anything COVID related. And what that also means is if we put those nurses into, say, the hospital setting and they're taking care of a COVID ward, that can spell those individuals that might have otherwise been designated to go and do the testing or the booster shots. Remember, boosters are still also super important. If I could do one thing, I would get everybody boosted. We have 430,000 individuals who have had their booster shot, and no one who's had a booster ends up in the ICU. So that's the way to avoid being very severely ill. So having those extra nurses helps everything downstream. But it's not a silver bullet because there's just so much need everywhere. The best thing that we can hope for is that the case counts plateaued this weekend. They peaked, and then they will plateau in the hospital, and then 8 days later, much lower numbers can begin to be expected. So hospitalizations are shorter with Omicron. They tend to be several days shorter. People are getting discharged more easily, and then they're home and getting well. So everything trends in the right direction with Omicron, but it's just a giant surge of overall cases.
All right, there you have it, the Lieutenant Governor. Dr. Green, we thank you so much. We always appreciate your time and insight.
Thank you very much. Take care.
All right, you have a great morning.